Suppose you have a car and you use it daily, uh, to go to work, come back home, go to work, come back home, go to work, come back home. And now for the past 50 years, 60 years, this car has been doing the job, even though you have never serviced it once, you have never oiled it once, you have never cleaned it. Um, your family has grown from just you and your wife to you, your wife, your uncle, your aunt, your cousin, your five children, your six grandchildren, and whatnot. And all of them still fit in one car, having the same suspensions, the same engine, and whatnot. Uh, and you have never really cared about the car or improving it, or managing the load that there is. What you have done is just released fancier version of the car in theory, or rather promise spending money on a new paint job. Yeah, promise spending money on a new paint job without ever really taking an evaluation of what is happening on a ground level. And then one day, you get a call saying you need to be, the entire family needs to be in Delhi. Suppose you're in Bombay, you need to be in Delhi in the next 18 hours, and the only resource you have is your car. And your entire family, all your belongings, everything in your house, and the entire neighborhood has to fit in that car and take you from Bombay to Delhi in the next 18 to 24 hours. Now, obviously, the car was never meant to handle this situation. No car is in the world. But that does not mean you forget the abuse you have been giving to your car for the last 50 to 70 years. Okay, back in the day when you bought the car, you were really poor, and this was all you could afford, and nobody is blaming you for not taking care of the car in the early years. But now, when you have money to build statues and uh, have holograms campaigning for you in rallies, and you can build a high-speed railway and wait, hyperloop, yeah, hyperloop, and expand your airports and whatnot. You still don't give a shit about your car, which is how you're going from your home to your work and back, and which is basically how you're alive. So now, what people forget is like, oh, Sharma ji in USA is having trouble with his cars. Italy is having trouble with their car. Our car is also having troubles because nobody was really ever prepared. There is no such thing as being prepared for a trip from Bombay to Delhi in 24 hours with the whole neighborhood in one car. You still ignored your car for 50 years. That is the state of healthcare in India. Healthcare is never really an election promise, meaningful change in healthcare, uh, because we're just used to death and morbidity and mortality on a community level, on a nationwide level. Things have changed, but ask your grandparents how many of their siblings were alive by the time they were 10. On a societal level, we have accepted death and morbidity and mortality to some extent, and that is why healthcare is not really improved that much. Everything else is improved and been accessible and cheapened so much. You have 2000 rupee smartphones which can practically do everything that a smartphone of say 1 lakh rupees can do. Only it does it a lot more better, but still, what about healthcare? Nobody really gives a shit about it on an political or an administrative level. See, I complain to my seniors complain to their seniors. Everybody know in healthcare, everybody knows the problems. Okay, it's not like nobody knows. The dean will tell it to the director of health. The director of health will put forth a proposal to the minister of health, to the CM, to the PM, and whatnot. But no real change ever occurs, is because election promises are about things that are tangible, that people can feel in their hands. And you can't really feel anything if you're dead. And we're just used to that. You can feel roti kapda makan. You can feel an LPG connection in your house. You can feel the impact the cost of petrol has on your wallet. You can feel electricity. You can feel the bumps on the road. You are not going to feel your father dying of diabetes over the course of 10 years. You're not going to feel your mother dying of stroke sometime in the next 20 years, like that. You can feel, uh, you know, the stench, the heat, the lack of resources in a hospital, in a public setup hospital. You can feel that. But that's a once in a lifetime thing for people, and for most of them, they don't give a shit. Everybody above the probably middle income group does not rely on healthcare, on public healthcare, sorry. Uh, I would say 80% of middle income and above people rely on some or the other sort of private healthcare setup for their healthcare needs because they can afford it. And if you look at the facilities that public healthcare offers, is on an institutional level, say a tertiary level, not really that different from a public healthcare hospital in any of the metros. The difference is the cost, and you're willing to do that because it is quicker, easier, and just more accessible, and you have the money, so why not? What about the 70% people, the 60% of the population that relies exclusively on public healthcare for their health needs, who cannot afford a Wokhart or a Medanta or a Hiranandani or a Leelavati or a Max Health or whatever, in insert your choicest private health hospital. Anyway, what about them? They are used to the mortality and morbidity more than the rest of us because that's how life has been for them. And even for them, roti kapda makan, day to day survival is more important than health in the long term. And that is why there is no political will for change in health. Let me repeat, nobody in this country who can make a change on a political level or an administrative level gives a shit about public health care, or at least gives a shit enough to do something about it meaningfully in the last 50 years. And even if they did, the probably change was too less to account for something. I, I have seen uh, hospital roofs collapse in 2020 on people. I have seen rats eat at babies. It's just, pardon my morbid humor, but it's just, it sounds like the start of a bad dark joke, but that is the truth. And to expect such a system to manage COVID, to manage traveling from Bombay to Delhi in 18 hours with the whole neighborhood in one car is just preposterous. And frankly speaking, everybody in healthcare with any kind of experience in these things will, in at least private circles, definitely tell you that we are not prepared in the least for this kind of crisis in any meaningful way. So that's about it. Now, what can we do about it? Clapping for healthcare workers, banging thalis is definitely a morale booster for us. Uh, Dropping petals from Air Force planes onto hospitals at a time when people were still complaining about lack of PPE. Let's talk about crores of statues. Mm, mm, mm. Definitely good for public morale and tourism and whatnot. But what about the 15 odd community health centers in Bombay that are not really functioning at even 50% capacity or what they can be doing, let alone what they can be improved to be doing. So this is how it happens. Imagine, this is partly from personal experience, but imagine a 60-year-old man in, say, 150 kilometers away from Bombay having chest pain. He gets referred to, okay, so he goes, this is the healthcare setup, okay? He goes from that to its PHC, the primary healthcare center. The guy is like, okay, you have chest pain. Let's first see if I have an ECG machine. Oh, I do. Is it functioning? Do I have the ECG gel? Oh, no. Anyway, I am an Ayush health care provider, so I can help you with your basic things, but I really haven't, any experience in this, and it's okay. I don't have the capacity in this setup to treat you. I will refer you to one level up. So I get referred to whatever is the community healthcare center in the district. I go there. There's a line. You go in, you get tested, you get an ECG. Ooh, you have acute myocardial infarction, i.e., heart attack. Woo! What can be done? You need angioplasty. And the golden hour in universal cardiac health per se is around 90 minutes per door to needle time per se, but obviously it's going to take a lot. You're not really in a tertiary healthcare center. You get referred to one of the premier health institutions in Bombay. Yay, you say, not really. Because in front of you, there are 50 people who are suffering from fever, cough and cold. And they are all competing for that one doctor who's sitting on that one bench to be treated. And he can't say no to them. Because if he does, he's going to get beaten. The 22-year-old bodybuilder with cough is not going to think, what can this poor doctor do? And he's just going to call his political buddies, and they're going to wear clothes of one color and just thrash you on the head, saying, "Humko pehle dekho, mere ko kab se khasi hai, main aadhe ghante se khada hu." He's not going to care that you're probably intubating this aforementioned MI patient who is going into cardiogenic shock because she's literally going to die if he doesn't do that. Why is this happening in 2020 in a country which has done so much innovation in every other field except healthcare? We have one of the cheapest space program, and let me put that into perspective. It is cheaper for us to put a satellite into space than it is for some people to drive around in the US. It's that is a question of per kilometer, but anyway, just get that into your head. It is easier for India to put a satellite into space than it is to help somebody with a heart attack in 2020 within 100 kilometers of a city like Bombay. Now, okay, this is one of the worst examples. It's everything's not that bad. We're still saving a lot of lives, which otherwise would not have been able to be saved a couple of years or even last year. Or medicine is evolving constantly. We have innovations going on. Medical colleges and tertiary healthcare centers in public setup across the country are getting newer and newer things. We are getting new CT scan machines. We are getting new MRI scans. We have new operating setups being built. We have been putting orders into robotic surgery. We have new super specialty hospitals being built up in many districts. We have so many AIMS that have come up. We have centers of excellences that are being developed. This is all that is good, that as in terms of capacity building, in terms of resource building, that has been happening in the public healthcare system in India. But it's too little too late, frankly. And I know this is coming with a lot of frustration in my voice, and there's a lot of backstory to this, but COVID-19 has especially put all of this in the forefront, but we need to revamp the public healthcare setup in India as soon as possible. Stat, as they say in the business.